Well, the pandemic has brought about worldwide distress for many people, but many of the early reactions to it, as well as more recently with the truckers' protest in Canada, appear not to be concerned with the effects of COVID on the human body, the lives and well-being of others, or the incredible strain on hospital resources. Instead, we've seen extreme reactions and protests from people who felt their freedom was being stolen by their government. I'm talking about the anti-maskers, the anti-vaxxers, and those who won't keep their distance. Well, according to Professor Kahr, Sigmund Freud would have said we are suffering from a collective unconscious death wish. But what on earth does that mean? Well, I'm delighted to welcome Kahr himself. And Brett has just published a book called Freud's Pandemics, Surviving Global War, Spanish Flu and the Nazis. And the book leaves no doubt that Freud lived through as much as we ever have, if not more. And that was during his troubled historical era. And it also suggests that Freud would have had a lot to say about our self-destructiveness, which is acted out in group behaviour. So it is a pleasure indeed to welcome you, Brett. And yes, I'm fascinated by how close you must have become to Sigmund Freud. I mean, to many of us, we know he's the father of psychotherapy, and he's a bit of a dry, distant historical character, but you've made him sort of come alive again.
Well, I am very happy to admit that I am one of the people, and there are many, who has enjoyed a really lifelong love affair with Sigmund Freud, because ever since I first began reading him when I was a psychology undergraduate many decades ago, I really found his work extremely inspiring, because he gave us a real understanding for the first time that whatever is going on in our conscious mind, we have a deeper set of layers to the mind known as the unconscious mind. And this is far more active. This is like the storage of your computer, which archives all our feelings, all our desires, all our frustrations, all our hatred, all our data. And it has a far more powerful impact on how we relate as human beings than what we imagine to be the rational, conscious part of our mind. So I really found Freud's notion of the deep layers of the mind really very helpful, not least when I trained in mental health and began working with patients myself, because it really helped me to understand how very utterly self-destructive we can be and how very unconsciously other-destructive we can be.
Well, I'm going to get to that in just a second, particularly the collective unconscious death wish. I said it to a friend the other day who refused to have the vaccine. She said, well, I haven't got a death wish. What do you mean? So I'll get you to explain that in a minute. But can I just look back at Freud's life? Because, in fact, people are probably rather interested to know what he did go through, all the pandemics. In his childhood, cholera, anti-Semitism in his college, World War I, of course, disruption to civic life, Spanish flu, jaw cancer, and the Nazis invading Austria. So he really had a terrific amount to combat, didn't he?
Sigmund Freud was born in 1856, and he lived to the age of 83, dying in London here, where I am based. And over that 83-year life cycle, it is extraordinary how many pandemics of different varieties he had to navigate. And when the coronavirus pandemic broke out in the United Kingdom in early 2020, possibly late 2019, we do not know for certain. I really found that I wanted to turn to Freud and needed to turn to Freud, knowing that he had survived innumerable pandemics in his lifetime. And I thought, if we go back to his life story, what lessons might this very resilient, robust man be able to teach us? Because you're quite right. He grew up with innumerable cholera and influenza epidemics when he was a young man, then encountered all kinds of untreatable illnesses when he began as a young medical student in 1873 in Vienna. And then when he did something really incredibly radical by inventing what we now call psychoanalysis, that was considered so shocking in the 1890s because the traditional treatment for so-called lunatics, as mad psychotic people would have been referred to at that time, was first of all neglect. Most patients suffering from severe mental illness were given no treatment at all. But those who had the misfortune to see doctors were often subjected to horrific bodily invasions. Sometimes male patients would have their testicles removed if they suffered from dementia praecox, which we would now call schizophrenia. Female patients who struggled with hysterical neuroses would be subjected to hysterectomies and ovariectomies. It's not widely appreciated nowadays that psychiatry in the late 19th century was a very sadistic profession. And Freud really tried to humanize it by saying, hey, folks, come to my consulting room, lie down on this comfortable couch. I'm not going to touch your body. I just want you to talk to me. Tell me about your childhood. Tell me what's weighing on your mind. And he really created a paradigm shift in the medical psychological treatment of the mentally unwell by wanting to give people the opportunity to talk. So in my estimation, he's not one of these old, out-of-date white men. He is a radical frontline thinker.
Well, I think this is the moment then to get back to what he meant, really, because I'm not sure what view he'd take of how we've behaved in our pandemic, but probably you have because you've researched him. But he would have said, perhaps, that we're suffering from a collective, unconscious death wish. So could you explain that to us mere mortals, what that means?
Well, you're absolutely right. I only wish that Freud were with us today, because I have had to hypothesize in the 2020s what this man who died in 1939 might have had to say about these times. But because he did live through innumerable pandemics, whether they were of a virological nature, like the so-called Spanish flu, as you mentioned, in which Freud, may I just say that during the Spanish flu of 1918 to 1920, Freud's entire family succumbed to the flu. Sigmund Freud, his wife, all 6 of his children, and tragically, his adult daughter, Sophie, died in 1820 from the Spanish flu whilst pregnant with her 3rd child. She had 2 young boys. She was expecting a 3rd, and she succumbed just like that to the Spanish flu, which was even more virulent than the coronavirus pandemic, and as you know, resulted in infinitely greater number of deaths, alas. So Freud had to deal with that actual virological pandemic. But of course, he had 16 years of cancer, horrific maxillofacial cancer. He had to deal with the Nazis, who nearly murdered his eldest son, Martin Freud. They broke into his office. They held rifles to his tummy, threatened to kill him. Didn't, but threatened to do so. Then the Gestapo kidnapped his daughter, Anna Freud, took her in for questioning, and they did not know whether she would come back alive. Fortunately, she did. But Freud had to deal with years of Nazism. And he also had to deal with a pandemic of a different sort, which we might regard as professional shaming. Because when he first put forward his new radical psychological ideas about the talking therapies, not prescribing surgery, not prescribing institutionalization, not prescribing pharmacological interventions, the medical colleagues across Europe and even overseas in the States, United States of America, they shame Freud hugely and accused him of setting back science by years. They called him a pornographer because he dared to take an interest in the private sexual lives and sexual conflicts of his patients. So when the coronavirus pandemic broke out in 2020, the Freud Museum London had very kindly invited me to give my very first ever Zoom talk. I had no idea what Zoom was back then, but we wanted to do some fundraising for the museum. And I thought, well, what could we learn from Freud? Because he had survived so many of those pandemics. So that's really what the study was about. And I think you're right to foreground the notion of death wish, which was a term, very ordinary term based on the German word Tod, meaning death, and Wunsch, meaning wish. So the technical psychoanalytical term is Todeswunsch, a death wish. And as early as 1900, Freud had published this term for the first time. And he said, although we all intend to be very sweet and loving to one another, we sometimes harbor secret unconscious wishes that we may not be aware of. So, for example, you might be taking your romantic partner out on a lovely walk through the park, and you might think, okay, well, we're getting on really well. And then suddenly, you trip, and then your partner falls over, your tripping leg and breaks her leg or his leg. And Freud would say that might be dismissed as an accident, but it could be that that person really harbored some very unverbalized, unprocessed, hostile feelings toward the partner, and then unconsciously perpetrated some act of
so
violence.
that was the death. That's the unconscious death wish, right?
Absolutely.
So what would he make then of all the people who've chosen not to wear masks, not to get vaccinated, and not to keep a distance from each other? Because I would have thought, would he have been surprised that we've behaved in such a way?
Well, you've asked two extremely good questions. What would he have thought of these people, and would he have been surprised? And I think what I can say with great certainty is that because Freud had worked in the medical field between 1873 and 1939, an awfully long time, and he had heard everything, seen everything, nothing would have surprised him. So Freud knew better than anybody about the potential irrational parts of the human mind. So to have seen the riot in the Capitol on the 6th of January 2021, that would not have surprised Freud at all. He lived through innumerable wars of every shape and size. Certainly the First World War, all three of his sons went missing for many, many months. They were all frontline soldiers. And one of them was shot and nearly died. One of them missed being exploded by a bomb, which dropped on a trench by literally inches away. So Freud knew only too well, only too painfully well, how cruel human beings can be, have been historically. And he was himself a great historian. You go to his library, which still exists nowadays in the Freud Museum London in Hampstead, and you will see that he has far more books on ancient Greek and Roman history than he has on 19th century, early 20th century psychiatry, for example. So he knew every single battle, every single war in history. So this would not have surprised him at all. And I think he would have explained it by saying that based on his decades of clinical experience, he became only too aware of the unconscious destructivity of the mind, and that rather than, going around in an anti-vaccine, non-masking way as a consciously thought through choice, I think he would have reviewed the scientific evidence and might well have concluded that this is an expression potentially of harm to oneself or to others.
Yes, it's very interesting. There's this self-destructiveness. I wonder what Freud and you reckon with Novak Djokovic, who persuaded us all on television the other day, very rationally, of his reasons why he would give up a very successful career, actually, rather than take a vaccine.
It's very, very difficult, I think, for every single commentator, whether one is a broadcaster, as you know only too well, or one is, chatting privately with friends and colleagues, how we process the news. And no two people, in my experience, are interpreting the news with which we've been, overwhelmed in quite the same way. Some people, I think, might respond to the Novak Djokovic story by saying, well, he's an intelligent professional man. He's allowed to make his own choice. Others would say, well, why, when zillions of people have been vaccinated and there's an immense amount of scientific evidence, why wouldn't an intelligent man do that? So no two people have been managing it in the same way. And I think what I've come to learn from my own clinical practice, because I work every day as a psychotherapeutic practitioner with individuals, with couples, with families, as do many of my colleagues. And we have been keeping really close tabs on who has become ill with COVID during COVID and for what reasons. There's a real difference between somebody who's been treble vaccinated, masking, hugely cautious, and yet, in the last few months with the emergence of the Omicron variant, in spite of the fact that those individuals have been so cautious and so thoughtful about themselves, their family members, their community, their 8-year-old child might have gone to school that day, contracted it, and then brought it back home. So although that parent was always being very careful, that was not a parent who'd say, okay, little child, sleep in the street tonight because, you've been exposed and mummy and daddy can't have you in the house. It's a very different kind of contraction to somebody who, for example, might have gone out clubbing in the middle of a pandemic. When there were restrictions saying this is the peak of the infection, don't go out clubbing. Many people have slept with sex workers or done all kinds of things which would have put themselves at even greater risk and others at greater risk. So I don't think Freud would have looked at the notion of the death wish in quite the same way for quite each individual person. But I think he would have hypothesized, and I appreciate this is an hypothesis, he would have hypothesized that the more traumatized an individual's background might have been, people who had perhaps been very grossly abused in childhood, very neglected, their bodies had been neglected, those would be the people who might potentially be at greater risk to keep putting their bodies at greater risk and the bodies of others at greater risk.
But is that because those people are more self-destructive, or is it? Or how does that come about? Their response to catching it then?
I think without actually going into the details of a particular case, which is very confidential and one can't do outside of the consulting room, I think it's very difficult to make those estimations. I want to be very clear that I am absolutely not suggesting that an individual who might have been bodily abused would then be spreading COVID more than somebody who wasn't. But if you have had a history of bodily abuse or psychological abuse, that does potentially put you at greater risk of harming yourself and harming others. We do know what every traumatologist would agree with, Chrissie, is that if you have been traumatized, you are very likely to repeat trauma across the life cycle in a very unconscious way. And the good news is, when people have undergone psychological treatment of one kind or another, whether psychotherapy, psychoanalysis, counseling, people who've really stuck with the process in a dedicated way, even if you have had a horrifically traumatized background and have been sexually abused, you can move in your mind to a place of real care and thoughtfulness towards your own self and towards the self of others. So some of the the most responsible people that I've met have been people with very severe traumatic histories who've really worked hard to work those through and overcome them.
Well, this is exactly what in these times was set up to try and get the message across that indeed you can alter your life chances and your life attitude by therapy. And we've hit a lot of roadblocks along the way, like government attitudes, money, CBT and all the rest of it. But if I could just come on to the book you published in 2020, because this is on a similar theme. It's about, it was called Dangerous Lunatics, Trauma, Criminality and Forensic Psychotherapy. I was rather interested by this because I know you believe very much in treatment rather than punishment. And I've always been fascinated by the concept of whether people are mad or bad.
Oh, we need multiple further conversations to do justice to the whole question of criminality. Let me say at the outset that punishment has always been an absolutely vital undercurrent to the treatment of criminality from the dawn of time. If you go back to ancient Babylon and the code of Hammurabi thousands and years ago, an eye for an eye, a tooth for a tooth. And in many respects, that still serves as the template for dealing with offenders. If somebody has committed a serious crime, they must be punished. And sometimes people are so very violent, they do need to be contained in institutions, whether it is a prison or a maximum secure unit, if they're diagnosed as being psychiatrically unwell. But whether we implement punishment or not, it doesn't mean that we then can't also offer treatment alongside containment / punishment. Because what we know from a number of studies is that when people are imprisoned for committing offenses and then released after they've served their sentence, often as many as 80% will reoffend. And the cost of that, financially, emotionally, just in terms of physical safety, is horrific. And my colleagues and I in the forensic psychotherapy community, working with offender patients by offering traditional psychotherapy, we really are hoping to make treatment in prisons, in psychiatric hospitals with offender patients much more available. And not only treatment for offender patients, but preventative treatment for those children and adolescents who might be deemed to be at higher risk of potentially becoming murderers, arsonists, pedophiles, criminals, fraudsters in later life. Because we can identify in many young people those early warning signs.
But it's a very grim picture, isn't it, Brett? Because if we talk about people in prison, I mean, they're locked up for 23 out of 24 hours a day. There's very little psychotherapeutic help. There's no money. I mean, when they have cuts in government, prisons are always, they're prime for those cuts. There are very few. There's one or two psychiatric hospital prisons, but and with children, I know you're very interested in this, the Centre for Child Mental Health, but the actual prevention thing, again, there's no money. There's nothing for child psychotherapy. I mean, they're overrun, CAMS and that, aren't they?
No, you're raising a vital point. And I wish that I and my colleagues in the mental health profession had an omnipotent, magical solution to convince wealthy financiers, charitable donors, government agencies to magically fund great mental health provision all round. I don't think that's going to happen overnight, much as we would love it to do. But the good news that I can report is that we must remember that 20 years ago, 40 years ago, 60 years ago, mental health was barely on the agenda in the United Kingdom, barely on the agenda. I remember when one of our registration bodies in the United Kingdom, called the UKCP, the United Kingdom Council for Psychotherapy was first launched in 1993, the inaugural chair went to visit one of John Major's health ministers at the time and said, "Can you turn us into a regulated profession?" And apparently this man said to the inaugural chair, "There are far too many of you psychotherapists with different trainings. Until you have a more united training, integrated training, we can't do that." So the fact that we now have, a shadow minister for mental health, for example, a minister for mental health, the fact that one actually, I gave a talk at the House of Lords 5 or 6 or 7 years ago about couple mental health. And I had the privilege to talk to quite a few of the members of the House of Lords. And I have to say, they could not have been kinder, more intelligent, more open-minded listeners. They were really keen to find out about the impact of couple mental health, and they took it very seriously, and they wanted to help. And we now have several members of the mental health profession who hold positions in the House of Lords. Baroness Hollins, for example, the Baroness Sheila Hollins, Lord Alderdice. They're both trained psychiatrists, but they serve in government. So this would never have happened 20 years ago, 50 years ago. We're now in a very, very different state where mental health is finally becoming less an object of shame and more an object of concern. So I'm quietly hopeful that as the years unfold, government and many charitable organizations and healthcare organizations will take psychological treatments more and more seriously.
Yes. I mean, the governments have to see that if you're going to stop people being sort of hurting themselves, being self-destructive, you have to do something to help them see that. And it doesn't start in school. Families are too busy. There's no money available for children and mental health services. So I'm wondering, a lot of people say, "Oh, I can't afford therapy," It's not a very happy picture. Governments don't seem to get it. They pay lip service to it, how important it is, but they don't put the money up. They don't make a noise about it.
Well, we must do more campaigning, not only practitioners, but every member of the public. It's a universal responsibility. And I think that we're very, very fortunate that over the last years, we've had quite a number of internationally renowned representatives. For example, Prince Harry and Prince William, very well-known global figures. They have come out quite publicly championing the therapies. Michelle Obama, in her wonderful autobiography, which I'm sure many people will have read, which was published, I believe, in 2018, she admitted publicly that, during their time in the White House, she and her husband, Barack Obama, had, quite a lot to deal with. It can't be easy to run the United States government for all that time. So they went to see a marital counselor of some variety. She was very open about it. And the Pope of Rome has also come out and said that he is a big supporter of therapy. Again, that would never have happened previously, that members of the royal family, somebody from the Vatican, somebody from the White House would have championed it. We have to acknowledge the turning attitudinally. And I think that will help us in our growing dialogues with policymakers and with investors. It's becoming much more normalized.
Yes. So if you had to make a comment on the state of, well, let's look at Britain, of our mental health. I mean, we've been through a pandemic. Some of us have been self-destructive, others haven't, for whatever reason, whether it's our unconscious or our conscious. What would you say about the state of the nation in mental health terms?
Well, I'm in a way rather impressed that more people have not gone off the rails, if I can describe it in that colloquial way. We have seen a rise in every single variety of psychopathology, ranging from depression, anxiety, domestic violence, suicidality. This is reported literature on a weekly basis. This is reported in the psychological literature on a monthly basis. I know very few researchers who are not working on the psychiatric, psychological side effects, long-term effects of COVID. And many of my colleagues would say, it's early days. We don't yet know the full impact of COVID on people's states of mind in 2025, 2027. I am very concerned about very young children growing up today who've had their basic sense of bodily safety questioned. I remember back when the HIV horror exploded globally back in the early 1980s. Today I work with a lot of patients, adult patients, as do my colleagues, who grew up as young kids in the 1980s, and they have a very frightened relationship to sexuality, because if you grew up in the 1950s, sexuality was much more physically safe. But if you grew up and you knew that you could contract this horrible condition called HIV, which could result in something called AIDS, then it made just kissing your girlfriend or your boyfriend a frightening activity. So what impact the COVID atmosphere will have on youngsters growing up today in 10 years' time, 20 years' time, we must wait and see. But I think we also have the opportunity to do preparatory work to help talk to children about their feelings of safety and security. So I think we have seen a lot of emotional carnage. I think we're going to see more. But the good news is that I do think that mental health is more cool, if I can describe it that way. When I was a young person growing up, nobody talked about being in therapy. I remember I had a young friend at school who looked very sad one day. I were probably 10 or 11 years old, and I said, "Oh, you look so sad. What's going on?" And this fellow schoolboy said, "Oh, my mummy and daddy are getting divorced, and I've been sent to see a psychologist. But promise me, you will never, ever, ever tell anybody." It was really considered something very disgusting to reveal that vulnerability, that you needed professional help over your private life. And that just isn't the case now. People are very, very open and appreciative. And, in some circles, people are concerned about you if you haven't been in therapy.
Really? I'm amazed to hear you say that. I mean, I don't know. I meet a lot of people who are desperately short of money, who are going to food banks, who the last thing on their mind is actually talking to a therapist. They think, well, that's for other people, not for me, and I haven't got the money anyway.
Well, listen, we have to work much. There are many low-cost and indeed free psychotherapy services available. We have to say that, but there could be many, many zillions more, because just in the United Kingdom alone, we've got tens of millions of people, and I'd like to see us get to a point where, just as every citizen is entitled to free access to a general medical practice, I would like to see every member of this country, indeed all countries globally, to have their own free psychological professional, whether it's a psychologist, a psychiatrist, a psychotherapist, a psychoanalyst, a counselor. We have such a wide range of different trainings and modalities, and an immense amount of expertise and experience, and we all have to work as a whole country to make that data, to make those interventions more affordable, more accessible, and less shaming. And I think it's starting to happen. But a project here could potentially play a vital role in just helping to educate and inspire people.
I really hope so, because I think it was Andrew Samuels who said, that therapy should be available in your doctor's surgery. It used to be in schools, but the cost factor has just cut in right across the board. And also, Andrew Samuels believes strongly in people being heard. It's not a professional model, but the fact that people can go and talk to people. And I think that's something I feel, having done these programs, very strongly about, because if we feel heard, we feel better often.
Well, I agree with Professor Andrew Samuels entirely. And, I think that we are moving to a more hopeful moment in global history in relationship to this, because we have over a century of depth psychological data. Freud invented the term psychoanalysis, first published in a French neurological journal in 1896. So we have a century and a quarter of depth psychology data. We now have, in this country alone, we have tens of thousands of psychotherapists and far more counselors and far more psychologists and far more psychiatrists. We've got maybe, 500,000 mental health professionals. So many students are coming to train in the different branches. It's becoming a really, really popular and admired profession. So I do think that we have to acknowledge how much of an historical journey the profession has gone upon over recent years. So we are becoming sturdier. We're becoming more outspoken now that we have people such as yourself taking a serious interest in this. That's going to make a big contribution. So I really do think we are moving in the right direction. But I would love for everybody to go home tonight and think, well, what contribution might I be able to make? Can I make a charitable donation? Can I talk to my GP and say, what can we do to raise money in this local community to bring a mental health professional on board? There's no shortage of potentialities.
Well, I think we're very grateful for Sigmund Freud for taking all those brickbats all those years ago. And getting us all to the point where we're talking like this. Brett, thank you very much for being there. Thank you for talking to me.
Thank you so much.